I'm Ezekiel Emanuel, Chair of the Department of Medical Ethics and Health Policy at the Perelman School of Medicine at the University of Pennsylvania. We undertook this comprehensive assessment of the attitudes and practices towards euthanasia and physician-assisted suicide, mainly because a lot of states in the United States and a lot of countries are beginning to legalize euthanasia and assisted suicide. And we wanted to understand what the practices were and what additional studies we need to understand these interventions. We went back to what we think is the first survey of the public by the Gallup organization in 1947, and we looked forward all the way to 2016, looking at studies both of attitudes towards euthanasia and assisted suicide, as well as the practices in various countries. Regardless of the country, these practices are not very widespread. So even in Belgium and Netherlands, which have tolerated euthanasia and assisted suicide and legalized it for the longest time, less than 5% of all deaths are by physician-assisted suicide or euthanasia. In the United States, in Oregon and Washington State that have legalized physician-assisted suicide, the longest, actually less than 0.5% of all deaths are by physician-assisted suicide. That is about 3 in 1,000 deaths are by physician-assisted suicide in Oregon and Washington State. So they're not a very common intervention. On the other hand, the longer the practice is legalized, the more it is performed. In the United States, public support from 1947 to about 1990 or the mid-1990s increased consistently, and then in around the 1990s through today, it has stabilized or declined depending upon how you ask the question. Typically, the public is more supportive of a case of a patient with a terminal illness who wants assisted suicide or euthanasia. The public tends to support euthanasia much more than it supports physician-assisted suicide. Conversely, physicians in almost all countries except the Netherlands and Belgium are much less likely to support legalization of physician-assisted suicide or euthanasia. Less than half of doctors in almost all countries support these interventions, and physicians tend to be more supportive of physician-assisted suicide than euthanasia. They seem not to want to be the people who actually do the injecting to end a patient's life. 70 to 75% of patients who end their life by euthanasia or assisted suicide, no matter what country, tend to be cancer patients. Most people have in mind that the patient who wants euthanasia or physician-assisted suicide is a patient writhing in extreme pain where the pain cannot be controlled with medications. That turns out to be not true in every country where it's been looked at. Patients who want euthanasia or physician-assisted suicide tend to be patients with more psychological reasons. They worry about the loss of autonomy or the loss of dignity, or they're no longer enjoying the activities of life. Predominantly, it tends to be white patients who are very well off and very well educated. Those are the patients who want to control the end of their life. A lot of people have a perception that euthanasia and physician-assisted suicide is a quick, painless, and flawless intervention. That is certainly not true. We don't have great research, but the research we have does suggest that there is a non-insignificant rate of complications and problems with euthanasia and especially physician-assisted suicide. Really, over the last 15 years, there have not been a lot of very good studies about the practices and attitudes related to euthanasia and physician-assisted suicide. And we need a lot more research to understand how legalizing these practices influences physicians, how they actually manage patients, how they attend to their pain and other symptoms before I think we rush headlong into saying that this is the solution to bad end-of-life care.